Coming up next.
Live from Los Angeles, this is the Special Report with Areva Martin.
I am so excited this morning to have Dr. Elaine Batchlor. She is the CEO of the Martin Luther King Hospital. She wrote a really thoughtful piece in The Atlantic where she talked about her own mother's hesitancy in getting vaccinated. And she said, essentially, I'm a doctor, yet my own mother has refused to get vaccinated. Good morning, and thank you for joining me, Dr. Batchlor.
Good morning, Areva. It's a pleasure to be here.
So I know you, I know your work, I know the hospital that you are the leader of, Martin Luther King Hospital. I know it's in South Los Angeles. So first I want to ask you about how hard hit has the South Los Angeles community been hit, or how impacted has that community been with respect to COVID-19?
Well, South Los Angeles has been hit extremely hard by COVID. We've had some of the highest COVID rates in the county. And our small community hospital has cared for more COVID patients than large tertiary medical centers like UCLA. CNN described our hospital as the epicenter of the California epicenter for COVID. So it's had a disproportionate impact on this community.
So how excited were you as a physician and as a doctor at a hospital that has had the kind of high rates of COVID that you just described? How happy were you when the vaccine became available?
I was thrilled when the vaccine became available. Here is this marvel of medical science that produced this vaccine in a record amount of time based on years of research. It is safe and effective, and it offers us a pathway out of the pandemic. I wanted to be among the first to get the vaccine when I was eligible, and I did. And everyone in my household quickly got vaccinated when they were eligible, as you know, except for my mother.
All right, let's talk about your mom, because I read that piece that you wrote for The Atlantic, and you said mom is educated, sophisticated, a very smart Black woman, but
Absolutely.
Yet knowing that her daughter is a doctor, not just a doctor, that her daughter leads this major institution, she still says no to the vaccine. Help us understand what mom's thinking is.
Well, as you said, mom is intelligent. She's smarter than me. She's educated, and she watches the news all day. She used to watch CNN all day. Mom has had experiences similar to many people in this country. She grew up during Jim Crow discrimination. She is fully aware of ongoing discrimination against African Americans, and she simply doesn't trust the government and doesn't trust the medical establishment. When the vaccines were first announced, I'll tell you what Mom said. She said, "Black people are not fools. We know the vaccine they're giving themselves will not be what they give us."
Wow. Wow. So mom is watching CNN, and I work for CNN. I watch CNN a lot myself. And most of the doctors that I saw on CNN talked about the efficacy and the safety of the vaccines. Do you think she was getting some of her information? Perhaps she was watching Fox or some, conservative network in addition to CNN?
No, CNN is her channel, and she also read a lot. So she was hearing the news, and she was hearing the scientists and the doctors talking about safety and efficacy. She was also hearing, especially early on, about a few concerns about potential side effects. So she was hearing the information. I was also sharing information with her. And explaining to her how the vaccines were developed, how they work. She heard all of that, but it was not enough to overcome her deep distrust of how African Americans are treated within the medical establishment.
So early on, when I started talking about vaccines and really trying to help spread the word of how important it was, particularly for those in the African American community, to get vaccinated, because I saw the numbers, the huge disproportionate impact that COVID was having on our community, we talked a lot about Tuskegee and the syphilis experiment that happened in Tuskegee. Was any of that news about any of that experiment? Do you think any of that was driving your mother's decision making?
Well, certainly what happened at Tuskegee has been part of the story of abuse and neglect of African Americans. But my mother never brought up Tuskegee. And we have plenty of disproportionate behavior going on today. So we don't need to go back 50 years in time to find evidence that African Americans are treated differently and that we have disparate outcomes as a result.
Yeah, and no doubt about that. And I've done so many shows, whether it's African American women and maternal health outcomes, whether it's infants, cancer, Alzheimer's. I mean, you just go down the list, as a doctor, what those outcomes look like for Black people and women in particular who are dismissed by the medical profession, who aren't believed when we talk about our pain and our symptoms. But one of the things I always ask people when they tell me that they're refusing to get the vaccine, I ask them if they are rejecting all of Western medicine, because I have a hard time logically understanding how they single out the vaccine, but yet many of those same people may take an insulin shot, or they may take some other kind of, medication that's prescribed to them by a doctor, and they don't have any history, any knowledge about the science of how that medication was created. So is there any way that you tried to talk to your mother to get her to reconcile what may be her distrust for the COVID vaccine, but other medications that she may be taking that she feels safer about?
I have had the same thoughts that you're sharing when people tell me, oh, I'm not going to have a COVID vaccine. And so then I want, well, are you going to have antibiotics when you get an infection? Because this is all based on the same, type of medical science. To be honest with you, my mother was very skeptical about everything, and she would carefully research and examine any type of medication that was recommended or prescribed for her. And I think the reality is that a lot of people don't take the medications they're prescribed. We know that a very high percentage of people don't follow their doctor's advice, don't take the medications they're prescribed, and that the number of people who don't do that is even higher in the African American community. And it is related to trust and communication and being able to build a trusting relationship where you feel comfortable following advice that you've been given. So I do think that it's not, just the vaccine that people are questioning or are afraid of. I think it's much bigger than that. And as doctors, we need to be aware that it's much bigger than that.
So what's happening at your hospital at MLK to combat that kind of distrust? Because your mother is fortunate, she lives with you, you're a doctor. So if something happens to her, you're going to be there to notice the symptoms. You're going to know to get her to the hospital. You're going to be able to get her the kind of care that many folks in our community don't have access to. So I know that the hospital has been involved in trying to help people overcome some of their fears and distrust. So what do some of those things look like?
Well, I think that one of the most important things is to have providers and caregivers who look like the community that's being served. When your nurse, when your doctor, when your dietitian is from your community and looks like you and understands your background, your fears, your experience, and is able to listen to you and hear you, I think that builds a more trusting relationship. And you now have the foundation for open communication and to build that therapeutic relationship that's so valuable. So I think it starts with having a diverse healthcare workforce that looks like the community that's being served.
Well, let's talk about that, Dr. Batchlor, because in the US, only, 4% of all physicians in this country are African American. maybe
A
2%.
very small percentage, yes. And
So
it
if you're
is
not in a major city like Los Angeles or New York or Chicago, your chances of even seeing a Black doctor might be slim to none. So what are we doing to address that? This is my first question. And secondly, if you live in one of these cities or rural communities where you don't have diverse providers, be it doctors or nurses, what happens for those people?
Well, it's one of the reasons I think it's so important for us to promote a pipeline of diverse healthcare workers. So it's the reason it's important for us to encourage our young people to consider careers in healthcare and to provide the resources for them to do that. One of the reasons there are so few Black doctors is it's incredibly expensive to go to medical school. We need to change that. We need to provide scholarships and funding and make it affordable for people of color to go to medical school. Or to nursing school or pharmacy school. We need to make sure that they're getting the education prior to professional school that will make them competitive in applying. So I think it's really important for us to open the professions up and ensure that everyone in our country has an opportunity to consider these professions and to move toward a workforce that looks more like the people in our country. I think the other thing we can do is engage people in the community and educate them and use them as ambassadors and bridges to the community. I know that you're having another guest on your show who's going to talk about work being done in barbershops and hair salons. I think that is absolutely essential for us to engage as many people in the community as we can in bridging the relationships and educating people about the importance of maintaining their health.
Have you seen any change in terms of attitudes, particularly now that we have this recommendation from the CDC about a second booster? As I said at the beginning, we saw the president yesterday get his second booster on national television, and he does that, and he's done it with all of his shots to try to encourage more people. We've seen the vice president get her vaccination on national television. We've seen some athletes and other high-profile people do that. So have you seen the needle move in the community you work in as it relates to attitudes and acceptance and willingness to get the vaccine?
Well, I do think there is a large percentage of the community that is open to getting vaccinated, but needs access and needs for it to be convenient. And at the beginning of the rollout of the vaccine, it wasn't convenient. You had to go to centralized locations, you had to make appointments using a difficult to navigate computer system. We've tried to change that by bringing vaccines into the community, into places like schools and grocery stores and shopping malls and senior centers. So we've really taken it on the road and brought it into the community. And we've given thousands of vaccines in those locations. So we have seen demand for vaccination, but it's still not high enough. So we still have too many people who have not gotten vaccinated yet. So we need to continue to educate people, to talk about the safety and efficacy of the vaccine and the fact that millions of people across the world have been vaccinated safely, and continue to encourage people, because that's how we all get out of this pandemic as a community. And we know that our community has been impacted like no other community.
Do you have any concerns about some of the changes in the COVID protocols, like ending masks for school kids, even though we know a huge percentage of kids at school are not vaccinated and they go home to intergenerational households, and like the proposed ending of masks on public transportation, like airplanes, that's supposed to happen sometime mid-April? Do you think all of these changes are happening too soon, given that we still have millions of people who have not been vaccinated?
I have to admit that it does make me uneasy. So I worry about the people who are still vulnerable because they haven't been vaccinated. And we know that a lot of children, for example, have not been vaccinated yet. And I worry about the people who are at high risk. I think for people who are fully vaccinated and boosted, who are not, terribly high risk, I think it's less dangerous for them. but I'm concerned that we still have a pretty significant portion of our society, and particularly, people of color who have not been vaccinated yet. So I think we're all a little anxious, and we are waiting to see what's going to happen, hoping that we're not going to have another large surge. I think given how many people are vaccinated, if we do have a surge, it won't be as large as our previous surges. But I still worry about the vulnerability of our community.
Yeah, I guess it's the Omicron BA.2 variant that we're tracking now, that there's some concern that we could see another big outbreak come the winter months, the colder months. How concerned are you about that? We saw what
I am concerned about that. Yes, I do think that scientists and health professionals are anticipating that there will be another outbreak. We're certainly hoping that it won't be as large as previous outbreaks, but we anticipate there will be some additional outbreaks. And so we want to continue to encourage people to get vaccinated, because that is the one thing that will protect them and will protect our community.
And last question for you, Dr. Batchlor, do you think there's anything that you or anyone around you, professionals, friends, family members, can say to your mother that will cause her to have a change of mind and heart about getting vaccinated?
Well, Areva, I'm sorry to share that my mother passed away last winter, and she did not change her mind before she passed away. So, and I understood her concerns.
Oh, and I assume she didn't pass from COVID.
No, she didn't.
Wow, my condolences to you. No, I didn't know that your mom had actually passed away.
Thank you.
Well, thank you so much, Dr. Batchlor, for the work that you're doing at MLK. It's life-changing, groundbreaking work. And to have a small hospital like yours be the epicenter of COVID means that the state needs to be doing more to support the work you're doing, and more to support hospitals like yours, because you are, doing such amazing work with the most vulnerable population really in the state. So hopefully those resources will continue to flow into MLK.
Thank you, Areva.
Thank you for your time and for the work that you're doing.
Thank you.
My next guest is Dr. Stephen Thomas. He is a professor of health policy and equity at the University of Maryland, and he has creative ways that he's been trying to get African Americans and others to, lose their hesitancy about vaccinations and make sure that they are protecting themselves. Good morning, and thank you for joining me, Dr. Thomas.
Good morning. I cannot tell you how excited I am to be on your show.
Oh my goodness, look at you. I'm loving your background. You got your barber thingies, I don't know what they're called, and then you have your microphone and you are ready. And I'm told that you have this incredible video. Tell me about this video. Did you create it? Did someone else create it? But it's a video that you're using to help people understand why it's important for them to get vaccinated. So talk to me about the video.
One of the things that we've learned during this pandemic is that people have different learning styles. Some people could read a 50-page manual. Others need to be talked to face-to-face. And so we've taken advantage of the technology to lift up the voice of the people in our communities we don't hear from that often. And something your audience, all your audience may not know. And that's that Black barbershops and beauty salons are sacred spaces. Come on now.
Yes.
And and back me up here, no self-respecting Black barber would ever say, I get you not in 10 minutes. And it doesn't matter how much hair you have, you're going to be there half a day. So
yes, they're right up there with the Black church for sure.
Absolutely. Why not go where people already have trust? And for the past Areva, 15 years, we've been working in Black barbershops and beauty salons around the racial and ethnic health disparities. Remember those underlying conditions that cause Black people to die sooner from COVID? And so we made a pivot to bring COVID information into our barbershops and salons. And when we did the very first vaccine event in a barbershop, it was amazing. And then we realized we need to start capturing this. And so I'd like to take you into the into the neighborhood. Can I take you into the neighborhood?
Absolutely. Love it. Love what you're doing.
Well, your technicians are really good. And go ahead and roll that tape. It's a short one. Roll that videotape. The 25th anniversary of the African American Cultural Festival in Towson in Baltimore County. And I'll never forget a grandmother. She was eligible to get vaccinated in the very first wave, but here she was not vaccinated.
Yeah, I just didn't go nowhere to do it.
She says, I'm not going to tell my children I got vaccinated.
They're not going to get it.
And I'm saying, why is that? I remember when I got vaccinated.
Tell me when it's over. It's over. It's over. It's over.
I took videos and posted it on Facebook. A celebration.
It was easy. I thought it was going to hurt, but it didn't.
She got vaccinated. We heard her anxiety about not telling her family. But we also saw her frustration with a system that almost had her entering the wrong information for her next shot. The whole strategy is to bring the care to the community, to bring the care to settings where people already have trust, and to recognize that those may be unusual settings. And we were able to make arrangements for our Center for Health Equity where people came in to get the literature and, hey, a free haircut. We created that sacred space at a festival. And while they're sitting down relaxing, they're looking right across at the clinic where people are getting vaccinated, literally 15 feet away.
The whole family's come. Oh, great.
Who could have imagined we could turn barbershops and beauty salons into trusted information centers for COVID and beyond?
I was comfortable with coming here. I actually feel comfortable here than I would at a normal clinic.
Community engaged research can also serve the community. It's a place where you have trustworthy messengers.
Good afternoon.
I don't think that I can fully communicate what it was like to have the White House briefing come on TV.
In the spirit of meeting people where they are, we'll also be working with the Black Coalition Against COVID and other organizations to launch a new initiative called Shots at the Shop.
I couldn't believe I was hearing
beauty shops are hubs of activity and information in the Black and brown communities in particular, but in many communities across the nation. Local barbers, stylists, they become key advocates for vaccinations in their communities, offering information to customers, booking appointments for them, even using their own businesses as vaccination sites.
After our first vaccine clinic at a barbershop beauty salon, we get a call from the White House. You think you could scale this? And the rest is history.
To the first 25 people to get vaccinated.
We have over 1,000 barbershops and beauty salons across the country now part of the network. We can connect any barbershop or beauty salon in the country with a clinical partner to deliver COVID vaccines and ideally other health services. That's happening right now. And that's why, being here at the University of Maryland and our geographic advantage, so the solutions we come up with here can be applied across the country. If the hospitals can deliver a life-saving vaccine in a barbershop and a beauty salon, well, why can't they deliver the flu shot there? Why can't we do the diabetes test there? Why can't we do all the other non-invasive screenings that don't require you to be tethered to a hospital right there in the neighborhood? I think this is the game changer. And what I really like is that Maryland is leading the way.
Okay, Dr. Thomas, you're a rock star. I see you. I see you getting a call from the President of the United States. Asking you if you can scale your program. That is so amazing. 1,000 barber and beauty shops all over the state of Maryland.
All over the country. They're across the country.
Okay.
1,000 across the country. And as a result, many of the medical teams and the local state health departments, once they connected with that barbershop and beauty salon recognized that here was a partner living in the shadow of their own buildings that they didn't fully appreciate. It took a pandemic, Areva.
Yeah.
It took the president willing to think outside the box. And here's what we need to make sure that we do. This is one of the silver linings of this pandemic, because our people were suffering from the chronic diseases before COVID.
Right.
So if these folks retreat because the surge is no longer here, they will abandon us once again.
Yeah.
And that trustworthiness that we're trying to reestablish will be broken. We need your show and all the voices out there to make sure that we don't dismantle the very hyper-local strategies we use to reach our community. Hesitancy does not mean never. By treating people with dignity and respect, we had people show up hesitant and they left hesitant, but vaccinated. You don't have to change their worldview. You know how it is in the barbershop.
Get them to get a shot, right? You don't have to convert them to Catholicism. They don't have to become Baptist or Methodist or any of that. You know what? I'm so glad you said that, because what we are seeing, Dr. Thomas, around the country is the dismantling of testing sites and vaccine sites. So, it used to be you could drive down a street and there were tents everywhere with vaccines and testing, and that is going away, or it's gone away in most communities. Now, how is your program different? How are you all sustaining the efforts in these barber and beauty shops?
We are as vulnerable as all that you've just described. And I'm out here begging for charity and trying to raise the voice and being on shows like yours to say, don't ignore us. And let me tell you something. We should not disarm our communities. The distrust is earned. Mm-hmm. And you know what they said to me? Because they watched before COVID, my efforts to bring diabetes education, cancer education and outreach into the barbershops. And they saw me not get phone calls back. They saw me being ignored by these systems. Mm-hmm. Then COVID hits. And all of a sudden we got phone calls. Can we bring our mobile unit to your barbershop? And let me tell you what the barbers told me. They said, hey, Dr. T, that's the nickname they gave me. They say, Dr. T, are they just here to give us the jab and leave us with the diabetes and obesity and cancer? Mm-hmm. I thought that was very interesting. Yeah. And they're absolutely right. They want to give us the jab so we can go shop in the malls, go to our essential jobs, and not infect them, but leave us with the diseases. No way. I told these hospital systems, if that happens, we will have missed the opportunity to rebuild our relationship with the African-American community.
So are you seeing it? Are you seeing these health systems stick around, and are they treating these underlying conditions and not just there to give folks the vaccine?
It's a patchwork. So here in Maryland, I'm very pleased to say that we got hospital systems that said, Dr. T, we are committed to reimagining our relationship with these barbers and stylists and community outreach. And Areva, you should also know that here in the state of Maryland, we've gotten some of our barbers and stylists certified by the state as certified community health workers. That makes them legitimate frontline health workers. That's a different model. But we are very vulnerable to the resources going away. I would say this to them. Since the things you were doing before the pandemic weren't all working, because Black people were living sicker and dying younger, so why go back to those things? Take some of that money that wasn't working and put it into these new silver linings from the pandemic. I'm trying my best.
Okay, so you said Maryland you're proud of Maryland.
I'm proud of Maryland.
What are some states that are not getting the message that this is holistic and you just can't go in there, vaccinate people and then leave? Because that's going to, as you said, just fuel the mistrust that they only wanted us vaccinated so they could fuel the economy. What are the bad actor states? Let's call them out too. I mean, we're going to call out the good ones like Maryland. Let's put them on blast that don't get this message, because it seems like the perfect way to address this hesitancy issue.
Well, you don't have to go far. And the way they do the maps and color code them, it is like you're going down south to the high risk zones, you got a whole different dynamic. They're throwing off the masks, they're throwing away the mandates, not realizing that for many people, like grandmother there, they needed that mandate. Everybody needs a reason. We all have our reasons. And for some people who wanted to be down with the brothers and I ain't taking a vaccine, that mandate said, oh, I got to keep my job though.
Yeah.
I'm still down with you, brothers. but I had to get vaccinated. I had to get vaccinated. Ain't that a shame? And all of a sudden, when Omicron hit, a lot of our barbers and stylists started seeing members of their own family sick. As it got closer to them, they said, oh, this is real. Let me tell you the other thing, Areva, that we need to make sure to help our people with their COVID calculus. Who are you sharing air with? COVID is an aerosol. Have you ever walked in a room where somebody had been smoking, but they're not there? Right. You smell that smoke? No, aerosol. You ever walked in a room with someone with heavy cologne and perfume on? They're not there, but you smell it. Right. That's aerosol. That's COVID, but you can't smell it or see it. So we need better air filtration. We need to talk about respiratory protection, not just mask coverings. Guess what? I don't like to say this, but we got another wave coming. We got that subvariant coming at the very moment when people are throwing away the mitigations. And I think that we're going to see an uptick. And if people think, oh, it's just a cold, I got a mild version, you don't know what version you're going to get. And we don't know what long COVID ultimately will do. The flu doesn't cause you to have type 2 diabetes, but COVID does. The flu doesn't give you brain fog. COVID does. There are things about this disease we don't understand. So don't play with it. Get vaccinated.
I'm so disheartened by some reports out about long COVID. And again, the disproportionate impact on African-American communities that we are suffering the most and the worst from long COVID. And people, as you said, have taken this attitude that it's just a cold, just a flu. I had it, I had no symptoms, not recognizing that there is something out there called long COVID that has far-reaching implications for your long-term health. How do we get that message out? Because I think that message, Dr. T, has just been lost on people.
Well, I'm convinced that you have to actually show the suffering. The cameras go to the ER into the ICU and then kind of stop at the door. Sometimes when they go in and do that nice little profile, it's not people who look like us. So Areva, here's another big problem we have. A study just out in a major medical journal that as we raise awareness about health disparities and the impact of COVID on the Black community, guess what? For some white folks in these big surveys, they're less empathetic. They're less supportive of COVID outreach.
Because they think it's going to help Black people?
Because they think it is just Black people. Oh, it's their problem, not ours.
Wait, slow down, Doctor.
Oh, yeah. I got to send you this.
So you're saying this report says that as we emphasize more of the disproportionate impact on Black people, white people want there to be less focus on COVID mitigation?
We'll say that they're less supportive of the mitigation. They're less empathetic with those suffering. And they're and a whole list of things that you would think are counterintuitive. But for some of us who live in this world every day of racism, we understand how
wait a minute,
it happen.
That kind of report could cause there to be a waning, a lessening of the emphasis on getting this word out of how dangerous COVID is on folks like Black people who have these underlying conditions. Are we going to see that? Is that what you expect to follow from this kind of survey or this kind of report?
Anything else? I think we need to follow the science. We need not to be afraid of the science and recognize that these political efforts, think about it, Areva, political efforts to say you can't teach about racism in school anymore. Right. You can't teach about certain things if they make other people uncomfortable. That means that that underlies the very issue we're talking about here. So COVID has exposed a whole lot beyond just medical care. And I'm hoping that on your show, we have a chance to delve into this and to address social determinants of health and lift up the silver lining of what the COVID pandemic has showed us and sustain these efforts. And if we need to, do it ourselves as Black people from the Black community and bring on our allies.
Yeah. Are you getting financial support from the federal government? You got the call from the president. You then have the Treasury of the United States, or, I don't know, the SBA, the CDC, any FDA, any one of those agencies back up this work that they wanted you to scale with the financial resources to scale it?
Well, let's say that we don't have it all. And let me say this, at the White House, with a beautiful embrace, does not come with dollars. And I can show you all of our rejected applications, but I am so glad that we got a little gas in the tank to show feasibility and acceptability. And now we want to share this across the country. And we do have states around the country who are saying, hey, Arkansas, of all places, called and said, we're going to do this across the state of Arkansas. Wow. So we're on to something here. And let's help spread it around the country.
So how are these mobile units, these outreach efforts at barber and beauty shops addressing some of these underlying issues? So am I able to go now to my barbershop and have my blood sugar level checked? Am I able to go and get screening for diabetes or hypertension?
Oh, you are making me so excited about a future I see. That is indeed what should be happening. And in small scales, it's happening right here in Maryland. We're now, with support from the CDC, doing flu education with our barbers and stylists. And the education was provided by local pharmacists. And then the hospital system's coming in with flu vaccine. So we're in a delicate moment here. But if people think this is over and go to amnesia and just back to business as usual, we will have missed an opportunity to truly turn the corner and improve health outcomes in our communities.
Well, you said something really important, and that's even if you and others who are doing this work cannot get the support of the federal government, or reports that suggest that white people don't want to see Black folks get healthy, or whatever that report is, we've got to do it ourselves. We can't relinquish our own responsibility to try to build healthier families and healthier communities. I just want to thank you, Dr. Thomas. Your work is incredibly groundbreaking. More folks need to know about it. How can someone who's sitting out there who owns or works in a barber or beauty shop get this information if they want to bring it into their own community?
Well, we're working with the National Association of County and City Health Officials. That's the professional society of all the health departments. And they are the ones that help us link a local health department with a local barbershop. So just have your audience Google Maryland Barbers and Stylists United for Health.
Okay.
Maryland Barbers and Stylists United for Health.
Okay.
And that will, and I'm going to give you a link so you can put it out on your podcast as well. I'll put it in the chat.
Okay. And they can go there, get information about how their local salon can get connected with a local health facility to provide this kind of outreach and medical screening and vaccinations. So useful. And thank you so much, Dr. Thomas. Could not think of any better person. Obviously, like you said, this isn't new for you. You've been at this work for a long time. And I hope it doesn't go away because of some misguided notion that COVID is going away. And even if we are lucky enough to have COVID go away, as you said, those underlying conditions are not going away. And this kind of outreach and help is so incredibly important to our community. I'm going to be talking with you, have you back on, keep following this as we now try to roll out this second booster, see what success. I mean, we haven't done that great.
Yes.
The first booster.
That's
so
right.
Now we got a second booster, which I don't know. A lot of folks that didn't want to get number one, doubtful that they're going to get number two.
They're tired. Yeah. And that's why we
COVID
need
fatigue. We're hearing that word a lot. COVID fatigue, pandemic fatigue. Those are good signs. And
endemic. And the last thing we want is for it to be endemic in our Black and brown neighborhoods.
Yeah. All right, Dr. T, we're going to stay on this. Thank you again so much for joining me this morning. We're going to look for that information as well. Make sure we get it out to all those barber and beauty shops around the country. All right, joining me next is Dr. Moore, Dr. John Moore. He's our vaccine specialist. And when I saw the report that there is booster number two available now for anyone over the age of 50, of course, we need to get Dr. John Moore back on to help us understand what this means, because there's been some conflicting, as always, with these boosters, Dr. Moore. Some folks are saying this is really for people over 65, and they lowered the age to 50 because they wanted to make sure they got vulnerable populations and they got minority populations. Do you really need the second booster, Dr. Moore, if you're 50 or 51 versus 66 years old?
Well, you're right that it's been a topic of discussion among people that I communicate with in the health and science communities. Everyone agrees that for people over 65, it's a good idea. And for people in poor health, if you have an immunosuppressive condition, if you have a condition that makes you vulnerable to severe COVID, then yes, that makes a good idea. For healthy people in their 50s, not so much. I mean, it's not an urgent priority. What is much more of a priority is getting the first 2 doses and then the 3rd dose. And there's still an awful lot of people, as we've just been discussing, who have not received those vaccine shots. So they're the priority. The 4th dose for healthy people in their 50s is just not as important. And also, if you had an Omicron infection in January and February, as you know, tens of millions of people did in the States, you don't really need another vaccine dose in the near future, because the antigen exposure, the virus antigens that you got during infection, are roughly equivalent to a vaccine dose. So they've boosted immunity roughly equivalently to what you would get from a vaccine dose. So I'd rather spread that out. It's if you got infected with Omicron in February, that's only 4 or 5 weeks away. Leave it a while. I mean, the timing for these boosters or antigen stimulations it's 4 or 5, 6 months. It's not 4 or 5, 6 weeks. It's not like a dose a day keeps the doctor away. You should spread these things out. So you have to look at your own condition. What is your state of your health? When were you vaccinated? Were you infected? And try to make a good decision. But, err on the side of being vaccinated with dose 4 rather than not, if you feel you're at personal risk.
Well, the question is, if you had the first booster, how long should you be thinking? 90 days, or you mentioned 6 months? Is there a recommended time period that you wait from booster number 1 now to booster number 2?
I think a minimum of 4 months. 4 to 6 months is around the period. I mean, each time you get boosted, you increase the antibody levels in your blood, but then they decrease again. I mean, they decrease after dose 2, they decrease after dose 3, they will decrease after dose 4. And this is how it works. We'll see this permanently. If you go on to dose 5, 6, 7, and whatever, you will still see a decrease each time. But what you retain, and this is a key element of this, you retain protection against severe disease and death. A lot of this discussion is about preventing mild infections, which in some cases can be important. I mean, you don't want to have to take time off work if you're in a paycheck to paycheck job.
Right.
But it's not as important as preventing severe disease and death. And even the 2-dose vaccines are still doing a pretty good job of that. See, the real tragedy, and it's part of the discussions you had earlier, there were estimates that in 2021, something like 150,000 people died unvaccinated, despite being given every opportunity to take the vaccine. They chose not to be vaccinated. And in 2021 alone, over 150,000 people died as a result of that poor choice, often driven by misinformation. In the Omicron wave that is now more or less over, we were losing 2,500 people a day at the peak, and 90 to 95% of them were unvaccinated. So very few vaccinated people died this winter, and the ones who did had severe medical conditions, pre-existing conditions that made them, more likely to have a very bad outbreak of COVID despite vaccination.
How worried are you, Dr. Moore, about this new variant?
Well,
BA.2,
yeah. BA.2 is essentially Omicron. I mean, the other name for Omicron is BA.1. BA.2 is only subtly different from the original Omicron. It's a bit more transmissible. So it means that if BA1 and BA2 are both around at the same time, BA2 will take over. That's what happens. But it's causing the same severity of disease, which in vaccinated people is almost always mild. So it's no more dangerous. It's minimally more antibody resistant. So it's not like, I mean, Omicron versus Delta was a huge shift.
Right.
This is not a huge shift. And at the moment, we're a pretty sweet spot in the States. I mean, we're at 30,000 infections a day, which is as low as it's been ever since serious testing started. Mm-hmm. Now, it's probably only going to go up. So we're already seeing it ticking up in some cities, and it'll tick up in the cities before it ticks up in the towns and rural area. What we don't know is how much it will tick up. I mean, it's unlikely to be another huge surge like we saw in December, January, February. But we don't know. We don't know how far up that uptick will go. And it's ticking up because people are relaxing and because authorities in cities are reducing restrictions and just lowering the need to protect individuals and populations in the hope that everything's over and we can all, go out and go partying. I mean, that's what everyone understands the dynamics, but there's always a consequence, and the consequence are to see an increase in infections and at some point hospitalizations.
Yeah, it's pretty clear that the government, both state and federal, has decided that the economy is priority number one. Having people in office buildings, because restaurants and transportation companies and all of those businesses that rely on having people in downtown areas, that they pretty much have decided we need to get people back into big, tall office buildings and get them back into their regular routine to support the economic growth in our cities and in our country. And that just leaves a lot of people very, very, very vulnerable. And the mask mandates are gone. The vaccine mandates are gone. I've been traveling over the last couple of weeks. I've been in 4 different cities, and I barely saw anyone in the cities wearing masks. They were on the planes. I was on 5 flights, but we know in April that's going to be gone as well. They're talking about eliminating masks even on airplanes. So we know that Biden mentioned a new federal website where you can go to get information about antiviral medication, vaccines. So the government is saying, look, we have all these resources available, so we're going to have to just motor through this with these resources. I don't know. Final thoughts from you, Dr. Moore. What do we do? Do we just take our chances, go out with our mask, without our mask? It seems like we're all playing Russian roulette with our health.
Yeah, I mean, you nailed it, because there is this dynamic that you can't lock down an economy, you can't have restrictions because people suffer as a result of that. So, and yet, if you relax too far too quickly, there are consequences, and finding the sweet spot is really, really difficult. I mean, and some things are just very annoying. I mean, in New York City, the mayor has given exemptions from vaccine mandates to sports stars.
I know, but not city workers.
Yeah, and then because then of course once you cave into one lobby group who influential in the city, then every other lobby group wants an exemption as well, and then you wreck a policy that's been working, and that's that's just money talks and bad politics and bad policies, and it sends the wrong message at the wrong time, and it annoys the hell out of a lot of us, but. That's the nature of life in the States. Money talks, lobby groups have influence. The restaurant trade needs its profits back. And all of these things are, you understand it, but there are always consequences. There's action and reaction. And, what can we say? It's just, we have to live on a day-to-day basis and react on a personal level.
Yeah, I was in New York watching that press. I was in New York last week watching that press conference, as the mayor said with a straight face that if you're an athlete or entertainer in the city of New York, come without your vaccine and perform, because we need the dollars and the revenues from those shows and those stadiums. But if you're a city worker and you got fired because you wouldn't get vaccinated, you're not coming back to work. We still may require you to get vaccinated. So the hypocrisy and the double standard and the celebrity justice at play was just appalling. But
yeah, it was terrible. And it's also a false argument. There are only 2 or 3 sports stars on every team who are not vaccinated. It's a 90% vaccination rate. And so it's not like the team isn't going to turn up. It's 1 or 2 stars. So, and they've caved into Kyrie Irving and Aaron Judge and their owner, the owners of the baseball teams and the basketball teams, and pressure from some sports fans. Yeah. So, it's a complete nonsense, but there you go.
So I think the message for all of us, don't follow the politicians. They don't have your health and your best interest at heart. They have, their own elections are their number one priority in winning office. So thank you, Dr. Moore. Always a pleasure. Great information as usual. We're going to stay on this as new developments. We'll be coming back to you because we want to make sure people are making good decisions based on good science, not on politics, not on misinformation, but on science. And you always give it to us straight. So we appreciate your knowledge and your insights. All right, y'all. There's going to be a variant. The variant is already here, but as we're hearing from our experts this morning, not expected to be as bad as what we've seen in the past. The second booster is available. Dr. Moore said, if you're in good health, you're over 50, you have to gauge whether it's important or not for you to get it. Not as important as someone over 65, not as important as someone who has some other kind of underlying health condition. I say, talk to your doctor. This is an individualized choice. Don't read something in the paper or see something on TV and decide you need to do it or not do it because someone else is doing it or not doing it. Knowledge is power. I've said that so many times on this show. I love what Dr. T is doing, spreading the word. If you know a barber or beauty shop or you think it would be great for them to get information out to the Black community, make sure they know about Dr. T and his work, because that is one way that we can reach Black folks. He says he doesn't care. He's not trying to convert you, doesn't care what you think about the vaccines. As long as he can get you a shot in your arm, then he's accomplished what he wanted to accomplish as a doctor who cares about lifting up our community. And I just heard our vice president say, these are my words to live by. It's not who we beat down, but who we lift up. And we all have an opportunity to lift up individuals and our community by continuing to spread good, solid, scientific information. You get that kind of information right here on the special report. Refer folks to our shows. They're online, they're on Facebook, they're on YouTube. You can download them. You can see what the experts have to say about the science of COVID-19 and the vaccines. Be safe out there. And remember, we're all in this together.